Catheter-associated urinary tract infections, or CAUTIs, are a significant healthcare burden with over 1 million cases diagnosed each year, leading to 13,000 plus preventable deaths. CAUTIs cost the U.S. healthcare system hundreds of millions of dollars annually, not including the millions of dollars lost to hospitals from CMS penalties associated with high CAUTI rates. For years, researchers and policymakers have poured millions of dollars into Foley catheter coating technologies and Foley catheter care training protocols without significantly reducing the incidence of CAUTIs. Nobody has really addressed the core problem: flaws in the design of the Foley catheter. Upon insertion of any catheter into the bladder, urine drains out and the full bladder decompresses. Unfortunately, as a result of this decompression of the bladder, the tip of the Foley catheter and drainage eyes come in contact with bladder mucosa, causing trauma to the bladder lining due to the contact pressure and drainage suction respectively. This results in the breakdown of the protective glycosaminoglycan layer and bladder mucosa, which is the bladder's primary defense mechanism to protect against infection. Damage to the bladder mucosa causes inflammation and disruption of the mucosa, allowing for bacterial biofilm formation and invasion. As CAUTIs are predominantly traumatic rather than infectious events, the Foley catheter was designed to reduce the risk of bladder trauma and improve urinary drainage. With its patented, low-volume, low-profile, donut-shaped balloon and open tip, the Foley catheter is able to continuously and more completely drain the bladder while minimizing bladder wall contact and mucosal injury. When it comes to CAUTIs, less really is more. The Foley catheter